In recent years, the prevalence of autism has risen significantly across all populations in the U.S. Diagnoses are more common among children of color, but one group, Somali Americans, is seeing an alarming increase. Fred DeSam Lazaro has this report from Minnesota, home to the largest Somali community in America.
Century Sunday. Century Sunday.
Century Sunday. I have 3 children, 2 girls and a boy, and they have all been diagnosed autistic.
Like this?
Yeah, like this.
2 of my children are verbal. One is partially verbal, and we speak, eat, sleep, autism.
Look.
For Anisa Haji Mohammed and husband Duran Ali, this is one of few outings the family does together in a routine otherwise individually tailored for their 8, 6, and 3-year-old children. On Sundays, the kids get to play in a safe space set aside just for autistic children. Haji Mohammed was a teacher. She has a degree in linguistics, but has devoted her life to advocating for autistic children in the Somali American community.
I always tell parents, you are going to face a period of denial. I experienced it with myself. Even though my daughter was showing very visible signs of autism, she was refusing affection, she had, different behaviors.
Autism is a brain development disability whose symptoms can range across a wide spectrum of severity, with repetitive speech and behaviors and verbal and social skills. Many public figures have confirmed themselves or been described as autistic. Scientists and tech leaders like Albert Einstein and Elon Musk, and the climate activist Greta Thunberg. But up to 40% of people on the spectrum have intellectual disabilities, lack basic life skills, and require lifelong care.
Good morning.
All parents are going to have a challenge when they have a child with disability, because what it involves is mourning the futures, the thoughts, the dreams related to what that child's life's trajectory is.
The ratio is 2 to 1.
But for immigrant patients and their families, Dr. Abian Bashir says there are other hurdles. The first challenge is finding care providers. Although their number has increased in recent years, Bashir is one of very few Somali Americans in a field where cultural background really matters, she says.
What I offer to them is familiarity and understanding the diagnosis in and of itself, and allowing them to grieve that in a way that doesn't stigmatize that or makes them feel bad. It's like, yeah, that happens and it's okay.
Autism is not widely understood in the Somali community, even though it's becoming alarmingly prevalent.
Overall rates in our 4-year-olds of 1 in 53. And what we were seeing in our Somali 4-year-olds were rates of 1 in 16.
That's astounding, isn't it?
Mm-hmm.
University of Minnesota research scholars Amy Esler and Jennifer Hall-Landy are part of a Centers for Disease Control Autism survey tracking the national rise in diagnoses in recent years. They were approached by alarmed parents to tease out specific prevalence in the Minnesota Somali community.
I'm glad that we were able to provide some confirmation on what parents have been talking about for over 10 years now, and hopefully this helps influence policy.
What they cannot answer is why autism is so prevalent in the local Somali community, where they also found higher rates of intellectual disability than in the general population.
Literally hundreds of genes have been identified that are linked with autism. So knowing how to predict autism ahead of time, we're not there yet. Having a biomarker for autism, we're not there yet either. There may be an environmental component, but we're very much in the early stages of learning what those environmental components might be.
Every behavior is communication.
It's not only the science that's lacking, but these parents said it's also support from a system that's under-resourced, foreign to them, even hostile. Faduma Ismail recalled taking her then 2-year-old daughter in because she'd begun to withdraw emotionally and stopped eating, hallmark autism symptoms. But she said the doctor brushed her off.
And she said, oh, Somali people, you guys like fat kids, chubby kids. Your daughter, she's fine. I say no, because 100% I'm sure something is wrong. So they took some blood and blood test, and they called me before even I go home.
She was summoned back because the tests revealed severe malnutrition. She received packets of high-calorie nutrition supplements and a home visit.
After 2 days, there is a lady coming visiting my house.
It was a social worker, as activist Idil Abdul noted.
The doctor who was supposed to help you, not only did she not help you, but she reported you to Child Protective Services so that you could lose the child.
The social worker found no issue, she says, apologized and left.
I'm still baffled to hear the lack of human decency from the system.
Until the Affordable Care Act mandated it, few insurers covered autism care. Minnesota's Medicaid program began coverage in 2018, and while that brought in more providers, there's still a long wait to see one for an official diagnosis, and then more waiting as applications are processed for services and state assistance.
I have a 4-year-old son on the spectrum. Officially, he got diagnosed when he was 2, and he didn't receive any early intervention till he was 3.5.
The delay in early intervention compounds programs later in life and may in part explain the higher incidence of intellectual disability among Somali children.
The earlier we intervene with children with autism, the better their life outcomes, the better their functioning is in terms of communication, intellectual ability, motor.
In a statement, Minnesota Human Services officials blamed workforce shortages and heavy demand for the long wait times. And there's another reason for delayed intervention, and it starts at home.
There are a lot of misconceptions about autism itself within the community.
Mahdi Warsama heads the Somali Parents Autism Network, which works in trusted spaces like mosques to encourage acceptance of mental disabilities.
Some parents, unfortunately, don't want anybody to know that they have a child with autism. They hide the child from the public. The child is going to miss a lot of developmental milestones and opportunities.
There are stories of progress in the parents group.
The apple of my eyes was born as autistic. We did find out very early age. I'm extremely lucky. Thank God, he is an amazing kid. He talks, he walks, he is in college.
When she first came, you remember?
She came in banging her head.
For many parents, like Anisa Haji Muhammad, progress is measured in small victories, like getting from intense headbanging to calm therapy sessions. She also senses growing openness in the community to now talk about autism, beginning recently with giving the condition a name in Somali.
Mangad, which is unique mind. We're giving a positive word to autism. Like it's not this big scary thing.
But one that will remain a daunting challenge at many levels for years to come. For the PBS NewsHour, I'm Fred DeSam-Lazaro in Minneapolis.
And Fred's reporting is a partnership with the Undertold Stories Project at the University of St. Thomas in Minnesota.